Welcome back. We've all seen the studies about how animals help us from loneliness, save us from loneliness, bringing a smile to nursing homes, and they can also help patients in recovery in very real ways. Baylor Healthcare System has an animal-assisted therapy program, and so joining us now to talk about the program and to introduce us to some of the ambassadors is Linda Marler, a nurse and a coordinator. Linda, thank you for joining us.
Thank you for having us.
So tell us who we have with us.
Today we have Tonka, an English bulldog who's 17 months old. And then Eli, who is a golden retriever who is not quite 7 years old.
Wow.
Beautiful dog.
Thank you.
And so now tell us, these are not dogs with specific training for specific illnesses or diseases.
No.
Tell us what role these dogs play.
These dogs actually go into the hospital to visit with patients. They're also used in the rehab facility working with the therapist and the patient. So they can do retrieving, they can be brushed by patients, things like that.
I was just about to ask for an example. So brushing, if you're
brushing
rehabbing
them,
from some sort of an
throwing
injury.
the ball for them, just getting fine finger movement by just scratching the dog, naming the dog's parts. I mean, there's all kinds of things that you can do for the
And there's
dog.
seems to be more and more research coming out all the time about the demonstrable benefits that patients recognize in working with animals.
Right. It lowers the blood pressure, it lowers the pulse rate, decreases the patient's need for pain medication, or just some of the things.
That's fascinating.
So these two can play many, many roles, but there are some dogs who are specifically trained for specific therapy needs, right?
Correct. Well, those are called service dogs. Service dogs are trained to individually help one person.
Okay.
And those dogs you should not be petting.
That's true.
Because they're working dogs.
Because they're working dogs. These guys are there to go into the hospital to visit with a lot of different people. Tonka's going to make himself comfortable.
Oh,
there.
yeah.
Please
Well, he needs to.
do.
So how long have you been a part of this program at Baylor?
I've been a part of this program since about 1989.
And tell us how you've seen the program grow. I'm sure it started off
This
it's smaller
program
than what
has
it is now.
started off with one dog
Wow.
in 1985 and has now grown to about 93 dogs.
Wow.
I have 83 volunteers with 93 dogs, 2 parrots, and 1 pony.
Now, what in the
parrot.
world do the parrots do?
The parrots visit people. Some people aren't all dog people, and they have
Really?
birds, and they prefer to do that.
Yeah.
So they visit like that.
And the pony?
The pony visits at the rehab hospital. We had one patient not too long ago who was missing her horse at home. So the pony walking in was a big thing for her.
So what makes a good therapy dog?
A good therapy dog has empathy that likes people, that has empathy for the person. They're well behaved. Doesn't hurt that they know some tricks,
Right.
but they don't have to know tricks.
They're part caregiver, part entertainer.
You're
Right,
right.
right,
You're right
exactly.
about that.
Hasn't this become really a lot more mainstream? It was somewhat experimental in the beginning, and now it's hard to find a hospital that doesn't have some kind of program like
You're
this.
right. You're right about that. That is more and more out there.
This face is just
Oh, yeah.
priceless.
Yeah.
So do
That
these
just
guys,
says compassion.
These
doesn't it,
guys
that
live
face?
with their volunteer. Where do they
Both of
go?
these dogs live at my house. These are my
these are
dogs.
yours.
These
Okay.
are my dogs. But yes, the dogs live with their volunteer.
Okay.
And the volunteer comes into the hospital, volunteers their time, and then takes the dog home with them.
So is there some training that is required for the pet or the handler, the owner?
Yes. In order to be in Baylor's program, there's other different programs out there. But
sure.
in order to be in Baylor's program, the dogs have to be at least a year old. They have to have completed a formal obedience class someplace, and then we test them in the facility.
Okay.
And then the owners have to be at least 18. According to Baylor policy, they have to be non-nicotine using. They have to fill out an application. They'll have their references checked, their background checked, attend the health clinic with 2 DP tests and a flu shot. And
All wise things to do anyway.
Right, and attend orientation. And then, excuse me, they can volunteer at the rehab hospital,
Okay.
Baylor Heart and Vascular, the Cancer Center, the Children's House.
Ooh, that would be fun.
Yeah.
That would
We
be
go
fun.
to some of the other hospitals, Grapevine, Irving, Garland.
And are you still looking for more volunteers?
Always.
Always looking for more.
How
Always
can people
looking-
contact you?
contact me at lindama@baylorhealth.edu.
Okay. We'll make sure
LindaHealth.edu.
Linda Ma, L-I-N-D-A-M-A.
Okay,
At
got it.
BaylorHealth.edu.
Well, Linda and Tonka and Eli, thank you so much for coming in.
Just his ears perk when
Oh,
he
yeah.
said Eli.
Oh, he knows his name.
Oh, yeah.
Yeah, it's a great program.
Thank you very much
Thanks
for
for
having
explaining
us.
it
Thanks
to
for
us.
bringing them in.
Coming up next on the Texas Daily, Obama opens up in a wide-ranging New Yorker interview. We're going to talk about that coming up next. Stay here.